All right. Welcome to the Alfi Podcast. We're on episode number 14, and fitting that we have such a special guest today. My dear friend, Susi Q, or Susi Quintana.
Susie Q. That's what everybody calls me.
Susi is a myofunctional therapist who treats many of our patients. And you really want to stay tuned and watch this episode if you care at all about your health, sleeping, your aesthetics, beauty, function. It's all related. We're going to get a lot of insight into this very, very special field of myofunctional therapy. And we're going to talk about what is myofunctional therapy? How did you become a therapist? What do you do? You're going to learn some biohacks and tools from the expert herself. We're going to get into sleep, mindset, a whole bunch of interesting things. You don't want to miss this episode. Make sure to subscribe, like, and follow. Susi, welcome.
Hello, thank you. I'm so honored to be here.
Yeah, I'm honored that you're here. Let's start with what is myofunctional therapy? Because I'll be honest, before I met you, I really had no awareness of myofunctional therapy. And I've been a jaw surgeon and interested in airway and sleep for a long time. Been in practice 13 years. Nowhere in my education or training or continuing education up until about 4 or 5 years ago when we met did I even know what a myofunctional therapist was. And now I look back at how limited we were because you're such an important part of the airway team. And we're going to talk about the airway team. But in terms of patients who need jaw surgery, which are almost everybody in this world, and go through it to prevent relapse, to really optimize well-being, function, outcomes, you are a critical piece of the puzzle. So let's talk about what is myofunctional therapy. How did you become aware of it? I know you started as a dental hygienist.
Yep, I did.
Let's start there. What is it? What do you do? How did you get into this?
So yes, I'm a dental hygienist. I've been a dental hygienist for 25 years. I don't actually do dental hygiene anymore, but I kind of fell into myofunctional therapy. I love dentistry, the mental aspect of it, everything about it, but physically it just wasn't working well for me. My hands, doing it for 20 years, my neck, my back, I was struggling, and I was trying to think about what other career paths I could take in dentistry. And I hadn't figured it out yet. At the same time, I'm going through a journey with my own child. I knew she wasn't living her best life. She wasn't sleeping well. She wasn't thriving. She was having nightmares, anxiety, various different things. And it's like I couldn't put my finger on what was going on with her. I just knew there was something not right. And I remember we had her tonsils and adenoids out. We did palatal expansion when she was 8, because that's normally the age that they do palatal expansion in orthodontics. And, the orthodontist was like, oh, she's a mouth breather. And I didn't really understand at the time that was like a negative type of description of someone, and what's wrong about that, how that can be a bad thing in a growing child. Fast forward, COVID happens and dental board shuts down dental offices because of aerosols and contamination. And then they said, okay, dental offices can reopen, but you can't use any type of mechanical instrumentation or aerosols. And I'm like, well, I'm out. I mean, that's a higher power speaking to me, telling me something I've known all along, that it was time for me to find a different career path. But that was really like what was finally the decision for me, was like, I can't hand scale. I can't do it the old fashioned way without aerosols because my hands just won't allow me. So in the middle of the pandemic, I retired from dental hygiene. I had no plan. I had no career. And a friend of mine, actually a mutual friend of ours, Christy, was like, you should look up myofunctional therapy. And I didn't know what it was. I had to Google it.
And Christy, let's shout out to her. She is the OG myofunctional therapist.
Christy's awesome. Yeah. So I ended up like looking into it, Googling it, and finding out that really essentially what it is, and I've kind of simplified the description of it over time, is that it's working on proper function of the mouth and face muscles is essentially what it means. As a society, we focus so much on exercise and working out, looking good, all these things. And we have leg day and arm day and ab day where we go to the gym and maybe focus on different things. But when do we have mouth day?
Mm-hmm.
And this area of your body is actually the most important because it's responsible for basic functions of life.
The most important
eating,
muscles in our body.
Breathing. Yeah,
right.
Literally the most important. And as you mentioned, it's not something you learn about in dental school or medical school. Like, who really claims those muscles or the tongue?
Right.
And so that's where myofunctional therapy comes in. It's really honing in on, how people are breathing, how people are talking, how people are eating, those basic necessities of life.
Yeah. And it's really a lost field.
It is a lost field.
Because this is not new. It's reinvented, really.
It is. It's totally reinvented.
In the history of human, oral posture has been so important for so many years, and it was something that people were actually conscious about. And we look at our episode, I forget which one it is, where we talk about The Breath of Life, a book written about 200 years ago.
That's all about tongue posture, and it's about
about tongue posture.
Optimal function, optimal growth. And in utero, babies' tongues should be resting in the palate, and then when they come out, when they nurse, the tongue works against the palate to manipulate the breast to get the milk out. It's a different function, a different mechanic than bottle feeding.
Yep.
Bottle feeding is just kind of pouring the milk in. So when that tongue is working against the palate, it's growing that palate before there's ever teeth there. It's starting to grow those jaws.
Right.
And, years and years ago, there was no formula. There was no bottle. There was no baby food puree. Babies went from breastfeeding, and if they couldn't breastfeed, they would die. So midwives would clip their tongue if they weren't able to breastfeed because the tongue wasn't functioning right or moving correctly. And they went from nursing to eating raw vegetables and eating meat off of a bone. And that's another thing that we've lost the art of chewing.
Correct.
So much of our food is processed and smoothies and blended, all these different things. So we don't chew like we used to either.
Right.
So I know you've done, lectures and different things about the evolution of the skulls, and our jaws are getting smaller and smaller with each generation. And that's why nowadays so many people have so many sleep problems. And I think that's truly the reason why there's so much anxiety, depression, ADHD, road rage. Like driving here, I see road rage, and I think, how many of those people aren't sleeping well?
All of them.
All of them.
All of them. Yeah, it's really interesting because the proper development of the jaws from birth depend on correct oral posture. Yeah. It depends on the tongue really pressing up against the roof of the mouth, the lips sealed, and these babies breathing through their noses, right? And like you said, breastfeeding, which for 99% of humanity before this industrial revolution was a necessity. There were no bottles. There was no formula.
Yeah.
And culturally, women were not in the workforce as they are now.
And that's what really
and away
started
from the babies, right?
The Industrial Revolution, when women did go back to work.
Correct. So there's a lot of factors. Not saying any of them are wrong. Some women can't breastfeed, and some, obviously, women have to go to work. But there was a reality to that side of it where it's different than 99% of human history, where breastfeeding was a necessity. Mothers really were able to focus on their kids' nasal breathing. They were able to stay up overnight, make sure the lips were sealed, and nasal breathing was important. And you think about, things that we talk about, like correct posture, chewing with your mouth closed,
standing up straight,
all these things that people still say. There were reasons we say it because they were really important for development of the oral structures. But we've lost a lot of that just because of industrialization, modernization. For a long time, up until recently, have taken it for granted what effects are happening from it. But skulls are getting smaller. And not only has it gotten smaller over the last thousands of years, it's accelerated over the last hundreds of years, and even in the last generation, I feel like it's gotten a lot worse.
Definitely. And that's why, you see it everywhere now. Like my kids see it. It's not just me. Like my kids even see it. We'll go to a restaurant and my daughter's like, "Mom, our waiter's a mouth breather." And used to, that was her title that someone, said about her. And now she's seeing that. And I look at people and I see the regressed chin. I see the small jawline. I see their mouth hanging open. And when the tongue rests low and they're breathing through their mouth, they tend to have more like a forward
Posture's
hunchback,
off.
rolled
Yeah,
shoulders,
it's terrible.
forward neck, all the things. And so it does impact your overall posture. Like you said, stand up straight. Well, part of that, when your tongue is posturing in the right place in the top of your mouth, it actually helps to balance your head over your shoulders, and it
Right.
helps you stand up better. When you breathe through your nose,
Yeah.
that impacts your posture because you're using more of the full lung capacity in your diaphragm. When you mouth breathe, it's cold, dry, dirty air. So you're just using the top of your lungs. So that will also lead to more of that forward posture
Yeah.
of your whole body, not just your tongue. So
Right.
it's all connected. Our whole body, there's like a
Mhm.
system there, a series of systems for a
Yeah.
reason.
And this happened thousands of years ago. Yeah, not just with packaged foods that are processed and easy to eat, but this happened as early as when humans were allowed to build crops and make rice and have a home, build a home and build a fire to cook their foods. You know, they weren't on the run hunting and gathering and having to chew food. They were able to put food on a fire, make it soft. We're talking about really, really early civilization where things changed. And now we have slow cookers and we love short rib and soups and all these foods. So chewing, not only breastfeeding, but chewing is been a huge component to this, because we used to have to, when we say we, I'm talking about early human.
Our ancestors.
Our
Right?
ancestors had to chew, and they didn't have the luxury of sitting and cooking meals either. So even as early, thousands of years ago, and when hundreds of thousands of years ago, just cooking foods started to change phenotypic expression, or basically what the genes produce.
And that's why so many people have malocclusion now. You know, it's the smaller jaws, the crowded teeth, not enough room for their teeth. They need their teeth taken out.
Yeah.
Everyone needs braces nowadays. Like
Everybody.
they're used to no one needed, they had nice straight teeth, and now everyone needs braces. And who is a candidate for myofunctional therapy? Malocclusion.
Everybody.
Anybody that sleeps
Everybody.
with their mouth open or breathes through their mouth or snores or has UARS or sleep apnea. Like there's so any TMJ pain because they're
Yeah.
clenching and grinding, or they're using their jaw muscles incorrectly because their tongue isn't functioning
Right.
properly.
So let's summarize that. So anybody that hasn't developed their jaws to its full potential
Yeah.
has consequences to that,
Right.
you know, and the biggest consequences to that are breathing and sleep. But down the line, posture, musculoskeletal pain, TMJ issues, right?
Those are all symptoms though.
Those are all symptoms.
And structurally, you create more space by, doing expansion. Rather, it could be palatal expansion, it could be forward jaw expansion like you do, or you do braces and realign the teeth, or you take out tonsils and adenoids like they did on my daughter when she was younger. But those structural changes don't change the function of that human. Functions have to be learned and taught, and new habits have to be created.
Right.
And that's really what it is it's building new habits, new functions
Yeah.
after, either before or during or after the structures have been addressed.
Yeah. So I don't know if you agree with this, but I think that everybody needs a myofunctional therapist. Everybody will benefit.
It's interesting because there's a kind of a misconception about myofunctional therapy. A lot of people think it's like tongue tie therapy.
Right.
That you only need it if you have a tongue tie. But I mean, you and I see lots of people that don't have a tongue tie, but they still need
absolutely
functional therapy.
Yeah.
And so, yes, someone that does have a tongue tie, yes, that's a big component of it. But there's so much more than that. Like you said, there's so many other people. So it's not just tongue tie therapy. And it's not just for kids, obviously. Like you and I see mostly adults.
Absolutely.
And that's another kind of myth or misconception, is
there are many studies that actually prove and show that more people today mouth breathe than nasal breathe. So nasal breathing, which is your nose is made for breathing, not your mouth. Your mouth is for speaking and eating. Nasal breathing is a minority.
I know, that's crazy. And it's literally the healthiest thing you can do. Like I say all day, every day to my clients that breathing through your nose trumps diet and exercise any day of the week.
Absolutely.
Literally the
So
healthiest
important.
thing you can do.
So important.
And we take it for granted, or we don't even know we're not doing it.
Yeah, totally take it for granted. The fact that it's a minority of people that breathe through the structure that they're supposed to breathe through their nose is wild.
And do you know that a lot of times, a lot of reasons for the jaws being narrow and small and the nose being deviated or constricted is because the tongue wasn't posturing in the right place.
Absolutely.
From the get-go. It didn't grow that upper jaw.
And then it's a downward
maxilla
spiral.
is also your nose.
Correct.
That's like when you do jaw surgery and you expand them forward, they are getting more nasal volume. They can breathe through their nose better.
Way better. We can create space there. Yeah. And the problem with that is that low tongue posture or improper tongue function, really, that causes a long face, narrow nasal passageways, then make people, they need to breathe through their mouth because they can't really breathe through their nose. And as they age, they get narrower,
worse,
and longer. And then that makes the airway worse, and then they end up really sick and become what we've normalized. Everyone over 50, with exception, is on some kind of medicine.
Yeah, absolutely.
Blood pressure, diabetes.
And if they're not, they need to be. They haven't gone to the doctor.
Correct. And instead of saying, oh, now, we just say, oh, it's just aging. Really, it's not. This is inappropriate. It's preventable. People don't need to be on all these medications. They don't need to really be debilitated, have this poor quality of life, die early, have strokes.
And that's what I was going to say. Ultimately, it leads to very sick people, and it can happen, as early as in their young years, before they're a teenager, in their teenage years, 20s, 30s, 40s, 50s, 60s. It can happen at any time. But ultimately, it leads to so much mental and physical health that can lead to death. And sometimes it can lead to death very unexpectedly.
Correct.
We've talked before with our physician friend that as a society, we just kind of like give things a quick label, like, oh, they died of natural causes. Oh, they died in their sleep. Oh, they had a cardiac arrest or a stroke. Why did they have that? That didn't just happen one day.
Yeah.
They didn't just eat a cheeseburger and fall over. It's like there were things leading up to that. And I think that's so much like you and I share the same passion of like trying to educate more people to really like doctors to screen for these things. Every dentist should be screening for it. Every MD should be screening for it. Chiropractors, every provider that's in healthcare should learn and know how to screen for these things. And the public should be looking for these things and know how to look for them and find out what's wrong.
It's above any other condition, it's the root cause of so many illnesses. And you're right. Every dentist and every physician, first and foremost, should make sure that breathing and sleep is optimal before looking at anything else. But not only does that not happen first, it doesn't happen at all.
I know. In a lot of
in
cases,
most
it doesn't.
of dentistry and medicine.
Yeah.
Thankfully here in Houston, we're seeing a lot of change because of the airway team.
We do. We have we have, the Houston Airway Study Club is also amazing. That started a little before me when I was just getting into myofunctional therapy, but later was passed on to me. And now I run the Airway Houston Study Club, which I think it is the largest, if not one of the largest in like the world, as far as a local study club that meets in person and does continuing education on a regular basis. So we have that. And through that, we know so many of the airway health providers in our area, and we have such a good collaborative network, and everyone's friendly. There's no competition. It's like we all want to learn together and grow together.
So there's a lot of passion.
So much passion. And then we've taken it a step further by creating the airway team, where we do more in depth, not just a dinner or study club. It's like we do a whole day intensive training. Like we've lectured together several times at that. We have more things in the works where we
have amazing programs
teaching these people how to like screen for these things and how to help these patients and create that collaborative team, because it's not just a one provider solution. It takes that team.
Yeah. And not only is it the largest group or airway study club in the nation or probably world, it's the most mature.
I think so.
Yeah, I know this. I mean, I traveled to LA, New York, Miami, big cities.
Yeah.
And everybody's way behind what we're doing here in Houston. And it's starting to catch on. I'm seeing way more activity in all these cities than I've ever seen. New York started one. LA started one. I haven't seen one yet in Miami yet. But I'm sure we'll start to see some soon. But Houston, at least 5 years of a mature group, and it's growing fast.
It's growing so fast. It used to be mostly dental professionals, and now we have, chiropractors and physical therapists and optometrists. So many other people
even
that are part of the team. Yes.
Right.
Pelvic floor therapists. So many other professions, and it's so
and it really
amazing.
should be everybody.
It really should be everybody.
It
everybody
should be
that's
the
in
first
healthcare.
thing that any healthcare provider screens for and manages and treats and directs before anything else, because ADHD, depression, anxiety, irritability, mood disorders,
brain
fog, dementia, Alzheimer's, high blood pressure, strokes, metabolic conditions, all are highly associated with this problem. Fertility, everything. And then on top of that, everybody today has a problem with breathing. And we know that because how many people need their wisdom teeth out?
How many people have malocclusion?
How many people have crowded teeth, bad bites? How many people mouth breathe? You know, if you take all these things, how many people snore? 99% of the population today has these. How many people have TMJ problems?
I was about to say that. Clench and grind. Right? That's a huge majority right there.
Grinding.
Yeah.
And it's really, you know, if we had perfect straight jaws for most of humanity and now we don't, guys, it's in your face. It's like you have an airway problem. And then what does that mean down the line? The problem is it's so normal that we're like, oh no, everybody snores. Everybody has ADHD, anxiety, depression, high blood pressure when you get older. You have heart problems. It's so normal that we don't step back and say, hey, why do we taking out the wisdom teeth, but why do we need wisdom teeth out? Why are our teeth not straight anymore like they used to be in ancient skulls? So I really think that, every provider should be looking at this. Every person needs a myofunctional therapist. And, you know, for healthcare providers that are out there that want to learn how to implement airway into their practice, and it's a game changer for the success of your practice and your patients, reach out to Susi or reach out to me. We have really exciting programs to get your clinics and practices up to speed and really change the way you approach patients.
Yeah, for sure.
All right, getting back to myofunctional therapy, I've been saying this for a while. I think it's the fastest growing healthcare profession
in the country. I mean, I've been doing it for about 5 years now, and it's really, the field has changed a lot. There's a lot more interest in it. It's definitely changed a lot in a short amount of time, and I see the growth even more in the next 5 to 10 years.
Yeah, and if really the truth is that everybody really needs a myofunctional therapist to biohack, live their best life, you're talking about a crazy, insane market. And if for those young people out there who are looking for careers, I think this is one of the most exciting careers with such huge rewards to it and an exploding market. So, you know, for those of you who are fortunate enough to listen to this, I think that you should really consider this field and try to find a myofunctional therapist to talk to, follow them on social media, because I think in 10 years from now, you know, everybody now like you is a pioneer, early adopter, but I think that it's going to be one of the most successful growing professions in our country. That's what I think.
Yeah. But it's so much more than that too. I mean, I do like help strengthen and function of things, but I also, in my situation, I mean, I'm really big on, I do a lot of, you know, guiding, and I consider myself an airway advocate. Like sometimes people come to me because they don't know where to start, or they've seen several different doctors and they're getting conflicting things and they don't know what to do. And, you know, in my personal experience and my professional experience, I try to kind of simplify for them and put it in an order. And maybe that's not the order they want to do it in. So then we maybe go to plan B or C and try to work through that. And then I'm oftentimes the person talking through you or their other doctors and trying to find the best solution for them or their family or whoever it may be. So, you know, there's other aspects of it too. I think you can take it and do so many different things with it.
You know, I always say that you're the quarterback of the airway team. I think that's true. It also may be the reason that it's myofunctional therapist.
Yeah.
Because essentially you do a lot of therapy.
There are some days where we don't do a whole lot of functional therapy. We do a lot of talking and a lot of support. I think that's a big thing too. You know, when people are struggling with sleep, like we talked about anxiety and depression and road rage, and, you know, these things take a toll on people. And if they haven't been sleeping well for an extended period of time, that's a big influence on how they're feeling mentally, not just physically. Sure. And so there's times where we just talk, you know, and that's more important than any type of treatment or therapy. So yeah, there's a lot of other avenues with it for sure.
Yeah,
I wear many hats.
You definitely do. All right, here, let's get into the meat of it. This is where I want the listeners to really get some insight, maybe some tips and tricks. 5 years ago, rarely did I send any patients for myofunctional therapy. Obviously, we had little awareness Now I send every single patient for myofunctional therapy. I think it's a critical part of the successful outcomes that we're getting is to get the tongue and oral posture to be appropriate. Not only does it help with function, but it really helps prevent relapse. Not only for surgery, but for anyone that's going through ortho.
For ortho too,
as well.
Definitely.
Anyone that's doing anything for teeth.
Yeah, you just saw somebody today that, we were talking about it. Oh, it's her tongue.
Right.
So we troubleshoot on things. It's like now you can spot it so much quicker. Like if there's an open bite, if there's this, if there's that, it's like, okay, it's that muscle in the way. It's that big tongue in the way. So yeah, jaw surgery patients for sure. I mean, ideally, like sometimes I work with people before jaw surgery and we work on a few things, but pretty much, well, I will say every case when they need double jaw surgery, they don't have enough space. They don't have enough airway space, which means they also don't have enough tongue space. So there are some things we can do on the front end, but the majority of it comes after they obtain more space. After you've done your magic and created a bigger space for their tongue and their breathing, then we can really hone in on the proper function of those oral muscles in that new environment. I always tell people, like, it's like you just moved the wall of your house and gained all this new square footage in your home. Right. Now your tongue has to like learn that new habitat and what to do in that space.
Let's just summarize some key points. Pre-surgery, what are some things you're doing?
Pre-surgery, we talk about tongue posture. We really talk about nasal breathing. I'm big on nasal hygiene, so I may have them start on, just some type of nasal hygiene regimen with saline solution, blowing their nose. Some people don't know how to blow their nose. Sometimes we do nasal stents, different things just to help them breathe through their nose better, go to the ENT. But a lot of times we know that if it's not super, super severe, it's going to totally be impacted when they have jaw surgery.
Right.
We can work on swallowing. We can work on tongue posture. And then after jaw surgery, we're going to work on getting things moving. Because the other thing I tell people is, you've had your skeleton move forward. You've got to work on those soft tissues to kind of catch up because things feel tight, right? You hear that a lot. Patients are like, oh, things feel a little tight after jaw surgery. Well, yeah, your skeleton has moved forward. So now we got to work on softening those tissues and catch up to where the skeleton is. Of course, we work on tongue posture, obviously, still, nasal breathing. Swallowing, all those different things, just how everything's functioning in that new space.
And it takes work.
Yeah.
While I'm sitting here, I had my lips closed, my teeth lightly touching,
your tongue up,
and
breathing through your nose
against the roof of my mouth.
Yep.
And I'm breathing through my nose.
Those are the 4 things. Tongue up, lips closed, nasal breathing, and then your jaw's just in
There
neutral.
you go. That alone, if you take away anything from this, that's a $1 million advice right there. Do those things, work at them as much as possible. And it takes work. It's not.
It does.
We did not, because of what we talked about, we didn't learn how to do that correctly.
Yeah.
This is not something that is part of our culture.
No,
like
it's
it
not.
was for many thousands of years.
And, there's a lot of times people say, oh, well, can't I just like watch some videos on Instagram or on YouTube? I mean, yeah, you can. Anybody, it's just like.
And it's better than not.
It's better than not. Right. It's just like, so for me, one way that I describe it too is like, if my kids show an interest in sports, if they truly show an interest in it, I'm going to get them a private coach. Like they wanted to play volleyball in middle school. Okay, let's do private lessons. You want to play tennis? Okay, let's do private lessons. You want to do cheer? Let's do lessons. I'm going to help them because I know if I try to like help them on something that I'm not totally skilled at, it's not going to be as successful.
Right.
And it's the same thing with myofunctional therapy or any exercise regimen. There's lots of people, they can go on YouTube and they can watch videos and they can do it themselves. It might not be optimal if they're trying to get like their bicep or whatever a certain way, but they can get some progress. And so I do have some people that have tried it on their own and then they realize they still need more help and they come and see me. And there's people out there that completely do it on their own. And I'm sure they have great success, but there's also things that they may not be looking for. Like I catch a lot of muscle compensations. A lot of times people overuse their jaw. They overuse their neck, like engaging neck muscles and shoulders and all types of other things in trying to like move their mouth and move their tongue. And so we're really trying to decompensate and eliminate all that overuse of the wrong muscles and instead use the right muscles the way they were intended. And, oftentimes, like I said, that goes back to tongue space. It could be a tongue tie. It could just be low muscle tone, not enough mobility, like various different things. So we work through a lot of that. And we're always pivoting like, okay, this might not work for this person. Now let's try this instead. And I think that's what like a personal coach is good at doing. So yeah, you can do it on your own, but you're not going to get that personalization.
Yeah, I agree. So post-surgery, Just take me through the most common, average, uncomplicated patient. What does it look like for them? How many visits? When are you starting? What are you doing? Basic.
Post-surgery, I usually start out with 4 therapy appointments. And I've had quite a few that's all we do. I mean, honestly and truly, like they're fully into it. They were maybe working on some things beforehand and they knew about tongue posture. And so we don't need to do as much afterwards. Sometimes we do more. So I kind of break up my treatment into phases. Like usually I do 4 appointments at a time. And it varies from person to person, but we're working on really making sure the lips are moving because usually they're a little numb, they're tight. So we really want to move the lips, soften the lips, try to minimize any type of scar tissue inside of their lips where those cuts were made. Like obviously where you, because you're not doing any cutting on the outside, it's all inside the mouth. And then working on the tongue, getting in the right place and functioning correctly in that new space.
The quality of outcomes and so many things we're looking at now, traditionally were never looked at in jaw surgery. And I think that the game is just such at a higher level. Internal scarring through the gums, minor little bands or something that we never really paid attention to before, just because the surgery itself was so complicated and imperfect that would be the least of the problems. But now things are so good,
we're fine-tuning.
Where a little scar band on the gums we can actually do better with.
Right.
And so many patients, you'll identify them, we'll work through them, make them better, or even release that band. And that little fine tuning can make the outcomes even better.
I've had a lot of people that have actually told me, of course the jaw surgery was the big thing and that was like 80%. And then it was like just those little tweaks and fine tuning. We work on some functions and then we work on cleaning up some little things in the end, maybe a tongue tie release, maybe scar tissues, maybe both. And it's like, then they feel like they got to the finish line kind of thing.
Right. And it's cool. I love the fine tuning. It really means that we're taking this surgery to such a higher level and working with a myofunctional therapist too, and having this airway team. This is nothing like what I learned in residency and what I started doing in training. And it's very few of us are at this level. It's still not standard. It should be standard.
No, it's not. You're one of the few oral surgeons that actually recommends myofunctional therapy because you see the value. You've seen, the difference in having it and not having it.
Absolutely.
And I think it's like so many things. Once you see it, you can't go back. You can't unsee it. So I think that's another reason why you said that the field is definitely advancing quickly.
100%. Yeah, for many reasons. One is that, we've been preaching about airway and talking about this stuff that's so common sense and the historical perspective, like we've been saying in this podcast for years now. And I think like in the last year, it's exploded. The attention to this, the passion for it, the awareness, not only for healthcare providers like dentists and physicians, where so many more people are interested now than they've ever been interested, but the civil population.
Oh, yeah. The population knows so much more now. And, there's a lot of Instagram has a lot to do with that.
Yeah.
People are mouth taping. They don't know why they're mouth taping, but they're mouth taping.
Right.
And it's like
people are talking about these things.
Yeah.
People are mewing.
Yeah.
Which is like basically myofunctional therapy unsupervised. It's a good thing.
Yeah. I'm not against it.
Right.
It's created a lot of awareness.
It is making kids look better.
It is.
It works.
Yeah. I get a lot of teenagers to be motivated to do their myofunctional therapy because I'm like, have you heard of mewing? All right. This is basically what we're going to do. You want to have a nice chiseled jawline? We need to work on these things.
Exactly. Yeah. So the awareness is at a level where, I mean, it's like 1,000 to 1 what it was even a year ago. And I can only imagine that trend is going to continue to explode. So if I can buy stock in myofunctional therapy, and maybe we'll talk about how we can do this.
Sure.
I think that has a very bright future.
I hope so. I think it's going in the right direction for sure. It's exciting.
Yeah. And it must be exciting for you to be really a pioneer, and Christy and all these other people, because, you guys are really early and we talk about we're writing the book as we go.
Right.
Because we're learning so much from each other, from treating patients, taking the game to a new level.
Fine tuning.
We're literally writing the book on this stuff, and it is exciting.
Yeah.
Because we're getting people healthier.
For sure.
And we are making lives better. So that's nice. You talked about nerve function. One of the biggest fears for people and questions I get about jaw surgery and anxiety about it is the numbness they're going to encounter in their lower lip. Thankfully, most people will regain sensation at about a year, usually sooner, 3 to 6 months. but it's something that they have to go through. Recently, we talked about things that can be done to get that nerve to recover faster. What are your, say, top 2 or 3 things that you think help with that nerve recovery?
I think my number one is mindset. I think that I told you, I talked to one of your patients last week, and she was, pretty fresh from surgery. I usually don't start working with people that early, but I just had a meeting with her to talk to her, and she wasn't moving her mouth at all. She hadn't been like getting up and doing anything. She was almost 3 weeks post-op, and I was like, you need to just go outside. It's beautiful out. Go for a walk, enjoy the sunlight, have a friend come over, and just hang out with you for a little bit, talk, laugh, like be yourself. And she wasn't doing any of that. And I just had her start trying to move her lips and move her mouth, just her lips, because she wasn't even like talking. And just that alone changed the rest of her weekend. That was Friday afternoon. Yeah. And so that's a big thing. I think movement is really big. Moving your body.
Absolutely.
In general, moving your mouth, like I said, talking, laughing, being around your family and friends. Try to get back to your normal activity, as much as you can, but also at the same time, listen to your body. If you need to take a nap or rest. But I think movement is big. And so I'm real big on movement, and I usually give people things to try to work on each day.
I agree. I think those are a great answer, because I really do believe that mindset more than anything dictates recovery.
Yeah.
It's really interesting. I heard somebody say this recently, but our minds are so powerful, way more powerful than we think. We are manifestors, and we can literally create our futures. And I've seen this on all fronts, and I've definitely seen it as a physician and surgeon treating patients. But we will prescribe our outcomes with our mouth, with our words. So, for example, if you say, I feel like I'm coming down with something,
you're probably going to get sick.
You're at that moment, as you say it, you are writing a prescription to come down with something. If you say, people around me are sick, but I'm going to sleep well, I feel good, I don't get sick. Those people sleep well, feel good, they don't get sick, because they write that prescription to feel well. Yeah. And this happens in every aspect of life. And some people are better manifestors than others, but it's something that everybody has the ability to do. I really truly believe that, and I do too. I believe that because I've seen it, and I've seen it in recoveries. And I feel like, when I was in medical school and I was learning psychiatry as a medical student, the way you learn psychiatry is through the most extreme conditions, right? So as a student, you go see end-stage schizophrenia, end-stage personality disorders. And then by seeing the worst, then you really understand, you can dial it back and get to psychiatry as a whole, right? We see that in medicine too. You really want to see insulin issues or metabolic disorders, you start treating people in ketoacidosis that are in a hospital with a life-threatening diabetic illness, and then you start to get appreciation of all these things and dial it down. So in surgery, operating on someone and putting through surgery and having them have to use their body to heal and recover, you get a glimpse at that extreme presentation, what happens in the normal presentations in life. So as a surgeon seeing these things, I can say for a fact that mindset really makes a difference in recoveries. And then to make that parallel, that analogy, that works on everything in life.
It does.
Right?
Yeah.
So,
it's like Johnny, like look how well Johnny did. And he just talked about that recently, mindset.
Yeah, totally. Like even if you, to that point, Johnny did amazing, and his nerves are recovering faster than all my other patients. Incredible. His swelling went down faster. He was back at work in 4 days.
He had his lips closed in the hospital. He was breathing through his nose. Like he sent me a picture. I'm like,
his mouth opening is normal. And, people keep asking me, did you do something different for your brother? And the answer is absolutely not. I treat everybody the same. But Johnny prescribed for himself.
He set himself up for success.
Because I remember before surgery, he said, I'm going to have the best outcome and recovery that you've ever seen a patient have. So he prescribed that for himself. So even, this is off topic, but if you want to be wealthy, prescribe that for yourself. Yeah. It's as simple as that. If you want to be wealthy, tell yourself you're going to be wealthy, live in that space, believe it, own it, and it will happen.
Yeah.
And if you want to be poor, tell yourself that you're unlucky and you come from generations of being unlucky and family members are unlucky and you're going to be unlucky too. And I promise you, you're going to prescribe that to yourself.
Yeah, I mean, that's how I started myofunctional therapy. Like I said, I quit my job and as a hygienist and just like dove into it in the middle of COVID. But I was either going to sink or swim. I'm like, I don't have the option to fail.
Mm-hmm.
There's no option for me to fail. So my mindset from there was like, this is going to work. There's no option to not work.
Right.
And that's how you have to be going into anything and everything, like you said, to set yourself up for success. So I think that's a big thing we're covering.
Absolutely.
And sometimes people need pep talks. You know, you're going to have good days and bad days, and that's okay. And you also have to give yourself grace. You know, you have to be kind to yourself. But sometimes, too, just talking through things.
Yeah.
You know?
Yeah, absolutely. Sometimes we need a coach.
Yeah. Or somebody to just listen.
Right.
And be kind to you.
Right.
You know? Kindness goes a long way, too.
Yeah, it does. Kindness does go a long way. What do you think are some biohacking aspects in terms of the sleep conversation when it comes to myofunctional therapy? Any tips you do for people for getting better sleep?
So in OSA, or obstructive sleep apnea, usually the biggest obstruction is the tongue. The tongue doesn't fit in its space, and so it will try to fall back where there's a void. The tongue is very greedy. It likes to take up any space you give it. Like if you extract some teeth, like some molars, the tongue is eventually going to try to find its way in there. It's like a little water balloon. It just starts to spread and creep around. Very, very greedy. So it will literally fall back in your throat and choke off your airway if you give it the opportunity to. If your tongue is resting low, if it's doesn't have good mobility, doesn't have good strength. So working on tongue posture alone is a biohack because you're getting the tongue up, out of the throat, out of the airway, so it's not interfering with that breathing. Because when we're sleeping, we should be breathing through your nose. Another analogy I use is like when you drink water through a straw. If there's a hole in the straw, you're not going to get the same flow through that straw. So when we're breathing through our nose, we should have this continuous tube or straw down to our lungs. If your tongue is resting low, the back of your throat then is open, or your oral cavity is open, so it's like someone made a hole in the straw. So by having your tongue fully up in the palate, not only helps with body posture, you know, the shape and development of your jaw, jaw structures after jaw surgery, orthodontic relapse, those kind of things, but it also helps you breathe through your nose more efficiently because there's no hole in that straw, so to speak.
I like that analogy.
So, and breathing through our nose, you know, as we kind of covered, is the healthiest thing you can do. And there's so many things now about mouth taping, but no one really talks about why you should mouth tape. And mouth taping is important because when we breathe through our mouth, it's cold, dry, dirty air. When we breathe through our nose, it's warm, humid, filtered air. And one thing I tell kids a lot is like, here's your science lesson for the day. Like Texas, TX, it's abbreviation. When we breathe through our nose, we get something called nitric oxide. And the abbreviation for that is NO. Well, you only get NO through your NOSE. So that's what I tell kids a lot because they're not going to remember nitric oxide, but they'll remember NO and they'll remember the NOSE. So I'm like, you need to breathe through your NOSE to get that NO because otherwise you're not getting it. And nitric oxide is a vasodilator, as you know. It's going to like get more oxygenation to every single blood cell in your body, primarily your brain. It's going to lower your blood pressure. It's going to help regulate your central nervous system, keep you out of that fight or flight mode, give you that restorative sleep that we all want and need. And then you're going to wake up feeling more refreshed. So that's why mouth taping is so heavily marketed now, because you're getting that nitric oxide and that restorative sleep all night, which is going to cut down on ADHD tendencies, depression, rage, brain fog, all those things that we've already talked about.
Right. And you have to be able to breathe through your nose.
You have to be able to breathe through your nose.
Right.
Exactly.
Let's talk about that. This is really interesting because, you know, we talked about proper tongue posture to be able to nasal breathe and how important nasal breathing is to develop a good face, right?
Yeah.
And not nasal breathing or mouth breathing causes sunken faces, long faces, recessed faces. Now, besides that, you know, that's obviously already such an important reason to want to breathe through your nose. But besides that, nasal breathing, like you talk about, has so many beneficial health factors. One of them being nitric oxide production, like you talked about. The others being warming and humidifying the air. And then we also have receptors in the nasal mucosa that tells us we're breathing, right? So the nose, was made as an organ system to breathe, and
and to filter,
and all these sub functions like filtering, humidifying, sensing, producing nitric oxide are coming from breathing through the nose. So this might be controversial. I have a lot of ENT friends, and so do you. But you think about that, and you think about to date when people have trouble breathing through their nose, which now we know is always from the jaws, a problem with the upper jaw, the lower jaw, the nose, primarily the upper jaw. The prescription was for ENTs to do turbinectomies, which essentially removes the filtration, humidification, nitric oxide producing and sensing functions of the nose. So essentially, removing the turbinates basically creates a mouth breather out of everybody, because they can breathe through their nose, but they're getting the same effects of breathing through their mouth minus, the facial features of it, but you're really losing the functional parts of it. So I say this, as a, wow, just thinking about it, this is something that as we become more aware of what's happening with breathing, with the jaw sizes, where the obstruction is, where nasal obstruction is, which is usually from the poorly developed upper jaw, should we really be questioning turbinectomies as a procedure because it's removing all those beneficial functions?
That's an interesting point. I've never thought about it like that. That's very interesting. That's going to get a lot of people thinking.
It should. Right. And I say this, for the betterment of humanity.
Yeah.
We really got to be thinking about this. And I know there are ENTs out there that are very aware of this, and they'll say, well, there are different ways to do turbinectomies, and you don't want to remove all the structures, and you could do minimally invasive types and all that. And that's definitely a better alternative than to just removing the turbinates, which is I've seen patients have had done. But I think that whether we move from no turbinectomies at all, which I'd love to see is all jaw surgery, or jaw appliances and getting the jaws better for nasal breathing, or to everybody doing minimally invasive turbinectomies to really preserve the turbinates as a goal as much as possible.
Yeah. I mean, I think that, going back to healthcare as a whole, I think we tend to overtreat symptoms and overdo things and not in the most holistic way, like taking tonsils and adenoids out. I mean, sometimes that is needed. But sometimes just switching people to nasal breathing, you can get reduction in those tissues because you're not letting that cold, dry, dirty air pass over the tonsillar tissue, which inflames them. So that's another biohack. Just nasal breathing alone can help shrink those tonsillar tissues. Breathing through your nose. And the thing about your nose is it's like anything. If you don't use it, you lose the ability to use it. So that's why I'm big on nasal hygiene. I'm a dental hygienist, but I use nasal saline every single day. I have it sitting next to my toothbrush. It's part of my regimen. I brush my teeth, I clean out my nose, and I wash my face twice a day. That's it, and I think that should be part of your regular regimen to make your nose more functional and not have to need a turbinectomy, hopefully, right? To eliminate that need. So trying to do everything beforehand to eliminate the need for extra procedures.
Right. And if you're going to need a procedure, address the root cause, which for 99% of the human population is going to be the jaw sizes, right? And we know that, like we said, crowded teeth, wisdom teeth impactions.
Yeah. Expand the maxilla, you're going to expand the nasal volume.
Right.
That's like, I always tell parents, you don't see a deviated septum in a 5-year-old. You might start to see some early signs of it when they're 10 or 12, and then as they continue to age. But that's because the tongue isn't resting in the palate and the nose continues to buckle. The tongue also is like a scaffolding. It holds up the maxilla or the palate, and the top of the mouth is the base of the nose. So that tongue is supposed to be resting there all the time to support the nasal structures, not only support the nasal airflow, like not having a hole in the straw, but also to support the structures and not get that buckling and have a need for any type of nasal procedure. Yeah. And that's why you have so much success with nasal breathing when you do advancement, because you're increasing that volume.
We tremendously increase the volume.
People tell me all the time, I woke up in the hospital and it was like someone opened the door and all this air came in.
Yeah. And I hear that every day when I go around on a patient. And what we're doing is not only are we moving upper jaw forward, but I do a special
You
maneuver.
do extra.
I do extra to increase the volume
Mm-hmm.
by removing excess bone at the floor of the nose. And we've
Mm-hmm.
seen exactly that. People say they get tremendous increase in airflow, and it's fun to hear it.
It is. It's amazing because, I've seen a lot of these people before, and I'm like, wow, this is incredible. Like your nasal volume is so much better. Because I do a simple test. I have them just lightly plug one nostril and breathe through one side, and then plug the other one and see if they can breathe easily through both sides. And then can you breathe easily with your lips closed through your nose for 3 minutes or more? Those are easy ways to test the effectiveness of your nasal breathing, because you certainly don't want to put some tape on your mouth if you can't do those things.
Right. That's true. That you're going to have problems breathing altogether.
That's going to strain your body out even more and really like put your central nervous system into overdrive and lead to more anxiety and more everything. So I definitely don't mind mouth taping, but it's not the first step.
Yeah.
There's other things first.
And to your point about the septum, so many people have deviated septums.
Yeah.
And
it's not from trauma.
It's
they didn't
not
get
from
hit
trauma.
By a ball.
It can be from trauma, but that's the exception also.
Not often.
It's probably less than 5% of people with deviated septums have because of trauma.
Right.
The majority of them, 95% or more, are because the maxillas are functioning, or basically the mouth is functioning as a nose, right? Because if you're mouth breathing, your mouth is functioning as a respiratory device, not just a speaking and chewing device. So the mouth starts to take shape of a nose. It becomes high vaulted and narrow. That's a good way to
describe it.
And the reason that's happening is because it's functioning like a nose. And then what happens is you get that high arch palate narrowness, and it buckles the septum because now the septum doesn't have room. So a lot of times, I tell people, if you have a deviated septum, don't do a septoplasty yet, because you need jaw surgery, most likely, and expansion. And when we fix that, we make room for the septum. In most patients, they can even avoid that septoplasty
Oh yeah, most of them
altogether. Some of them still may need it.
It's not often though.
But not often. Fillers, chin implants, rhinoplasty, septoplasty, turbinectomy, cheek implants, chin implants, all these things really shouldn't be done. Should really, maybe in some situations. But anyone that's looking into any of these, they should be looking at root cause, and that's going to be the jaws.
Yeah.
Myofunctional therapy, orthognathic surgeon, or airway orthodontist. And that's really not only getting at the best aesthetic results, but the best functional results and better health.
Yeah, that's what it's all about overall, better health,
Yeah.
longevity.
Exactly.
Right?
Better quality of life. I want to, just as a pearl to everybody that's listened to this conversation so far, who's endured it, I want the number one favorite exercise that Susi Q prescribes that people can take home with them.
All right, let's see.
And this is a biohack. Everybody pay attention.
Nasal breathing is my top one.
Okay.
And nasal hygiene, but also humming. We talked about nitric oxide. An easy way to produce more nitric oxide uptake is humming. Inhale with your nose and then hum. You're going to annoy your family doing it, but humming. Like I started doing this at home and my family's like, what are you doing? Doing it in the car, doing it whatever. So that's an easy one to do. Another one to do is clicking your tongue.
Yeah.
Like tongue clicks, because you can't have good tongue posture if you can't get your tongue up to the top of your mouth. Yeah. So just clicking your tongue and taking that a step further, we call it a tongue suction. When you click your tongue super, super slow and you see your frenulum or your string of your tongue kind of pop out, that's a tongue suction. And that's where you want your tongue to rest all the time. So you can walk around the house and do tongue clicks all day long.
All day long.
All day long.
And you're going to have a stronger jawline.
From right behind your two front teeth, not like way, way, way back in your palate or in the highest part of your palate. You want to click more forward. So if you say no or nah, where your tongue touches is right behind your two front upper teeth. That's where you should click from, but not on the teeth. It's just behind the teeth.
Huge. I'm going to go click today.
Hum and click.
And hum.
There you go.
I heard somewhere that the frequency that humming gives off is a healing frequency.
Yeah, it is. Well, like I said, it's a big nitric oxide producer too. It is a healing frequency. It's calming and soothing.
Yeah.
It regulates your central nervous system. It's peaceful.
Yeah.
It's
Maybe
good.
Not a coincidence that if you go to a yoga class, that there's always a humming session.
Oh, I didn't think about that.
Did you notice that?
Yeah.
They're up to something.
Interesting.
These yogis.
Yeah. But like a lot of yoga's a lot of times they'll say inhale with your nose and exhale through your mouth. I think you should do everything through your nose.
I agree.
Because if you exhale through your mouth, you can actually blow off too much carbon dioxide. You can over breathe, believe it or not. So you can over inhale and over breathe. So people that sigh a lot, they're eliminating too much carbon dioxide. Your body needs a certain amount of it. So I think everything should be in and out through the nose.
And I think that goes to, basic anatomy 101. The nose is the respirator. It's for breathing.
The mouth is rescue breathing.
Yeah, and it's rescue.
Yeah.
But its primary function is speech
and eating
and and chewing.
Yeah.
Right.
It really is. It's not meant for breathing.
It's for eating and speaking. The rest of the time, the lips should be closed.
It should be closed. Absolutely.
Yeah. All right. We're going to wrap it up. This was a fantastic conversation. Make sure if you like this to follow. We're going to have a lot of good content. We'll probably get Susi Q back on this because you're such an excellent guest.
Thank you.
And dear friend. And make sure to share, friends, family, healthcare providers. There's so much of this information that just needs awareness for better living. And we can avoid so many illnesses and problems just by having these conversations. Yep. So we're going to wrap this up with my favorite question. Who, in your mind, is the greatest basketball player of all time?
Golly. So don't get mad at me, but I'm actually not a big basketball fan. I'm more of a football kind of girl. So I don't really know a lot of the players. Obviously, I know who he is. And I we talked a lot today about mindset. And I think I don't know a lot about basketball, but I know a lot about his thought process and mentality and how he trained and what a positive role model he is for so many people. And so for those reasons, his mindset alone makes him my favorite.
Yeah, me too.
So
that's great. Kobe, I agree. You know what? For everybody listening out there, if you agree or disagree, comment below. I want to hear who your GOAT is. Let's take a poll.
That's a good one. Take a poll.
But so far, 2-0. Kobe's up.
All right. There you go.
All right. We'll see y'all later.
Thank you for having me.
Thank you for coming.